Welcome, esteemed viewers, to a crucial conversation that directly impacts your well-being. Today, we embark on an in-depth journey into the very heart of cardiovascular care protocols, meticulously tailored for you, individuals living with diabetes who are navigating a vibrant, yet often complex, landscape of life between 45 and 54 years of age. Have you ever paused to truly consider the silent dialogue occurring within your own body, particularly concerning your cardiovascular system? It's a dialogue that, for those with diabetes, carries unique implications, demanding a heightened level of understanding and proactive engagement. You see, for individuals like yourselves living with diabetes, the relationship between blood sugar control and heart health is not merely a correlation. It's an intricate, interwoven tapestry. Your diabetes, while managed, creates a unique physiological environment that can significantly accelerate processes such as atherosclerosis. This isn't just a medical term. It's a silent, insidious thickening and hardening of your arteries, often beginning years before any symptoms emerge. Imagine, if you will, the smooth, clear pathways of your arteries gradually and imperceptibly becoming narrower, their elasticity diminished, much like an old, worn pipe. This process, heightened by chronic hyperglycemia, insulin resistance, and systemic inflammation, all hallmarks of diabetes, transforms your cardiovascular system into a landscape requiring vigilant attention. Do you fully grasp the profound impact these internal changes can have on your daily lives, your energy, and your future vitality? The stakes are considerable. Unaddressed, these processes elevate your risk of major adverse cardiac events, including heart attacks, strokes, and peripheral artery disease. These aren't abstract possibilities. They are very real, tangible threats that could dramatically alter your quality of life, your independence, and your ability to enjoy the years ahead with your loved ones. Our purpose today is not to alarm you, but to empower you with precise, actionable knowledge, transforming potential concerns into opportunities for robust health and longevity. We are here to demystify the latest, most effective strategies designed specifically for your unique profile. We will meticulously unpack the critical pillars of cardiovascular care, the nuanced world of lipid management, the strategic imperative of hypertension control, and the judicious application of antiplatelet therapies. Each of these components plays a pivotal role in mitigating that accelerated atherosclerotic progression and, crucially, reducing your personal risk of those major adverse cardiac events. Think of these protocols not as burdens, but as sophisticated tools in your personal health arsenal, each carefully calibrated to protect your heart and blood vessels. Let's begin our exploration by focusing on the first, foundational pillar, lipid management. You're likely familiar with terms like cholesterol, but for someone with diabetes, the picture becomes more intricate. Your body's metabolism of fats, or lipids, is profoundly influenced by your diabetic state. This often manifests as dyslipidemia, a condition characterized not just by high levels of bad cholesterol, or LDL, but also by elevated triglycerides and often lower levels of good cholesterol, or HDL. Have you ever considered why these specific lipid profiles are particularly challenging for individuals with diabetes, or how they contribute to the silent remodeling of your arteries? This unique diabetic dyslipidemia is a potent driver of atherosclerosis, fueling the buildup of those fatty plaques we discussed earlier. Understanding this specific challenge is your first step towards targeted, effective intervention. In our next segment, we will delve deeper into the precise lipid targets recommended for you, discussing not just general guidelines, but the individualized strategies that can make a profound difference in safeguarding your cardiovascular health. We'll explore the various therapeutic options available and how they work to recalibrate your lipid profile, transforming your internal landscape to one of greater protection and resilience. Now, let us delve deeper into the precise lipid targets recommended for you. discussing not just general guidelines, but the individualized strategies that can make a profound difference in safeguarding your cardiovascular health. We will explore the various therapeutic options available and how they work to recalibrate your lipid profile, transforming your internal landscape to one of greater protection and resilience. So, what are these precise targets we speak of, and why are they so crucial for you, an individual with diabetes in the age bracket? For individuals like yourselves living with diabetes, the goal for your low-density lipoprotein cholesterol, or LDL-C, often dubbed bad cholesterol, is typically more stringent than for the general population. We are often looking at targets below 70 milligrams per deciliter, and in some cases, even lower, particularly if you've already experienced a cardiovascular event or possess multiple coexisting risk factors. Why this more aggressive approach? Because your diabetes intrinsically places you at a higher baseline risk for atherosclerotic cardiovascular disease, making every incremental reduction in LDL-C a significant protective measure. Do you truly appreciate how lowering this one number can dramatically reduce the likelihood of a future cardiac event? Conversely, while optimizing your high-density lipoprotein cholesterol, or HDL-C, the good cholesterol, is beneficial. The primary focus in diabetic dyslipidemia often shifts to effectively managing your triglycerides, aiming for levels below 150 milligrams per deciliter. High triglycerides, particularly when coupled with lower HDL and the predominance of small, dense LDL particles, form a particularly atherogenic trio within your unique metabolic environment. This specific profile, often exacerbated by poorly controlled blood glucose, significantly accelerates the formation and progression of those fatty plaques we discussed earlier. Understanding this specific challenge is your second critical step towards targeted, effective intervention. But how do we achieve these often ambitious yet vital targets? Your journey begins with foundational lifestyle modifications, which serve as the bedrock of all cardiovascular health strategies. Have you truly optimized your dietary choices to meticulously support your cardiovascular health? Focusing on a diet rich in whole grains, lean proteins, healthy fats, and abundant fruits and vegetables, while limiting saturated and trans fats and refined carbohydrates? Are you consistently engaging in regular, moderate physical activity, which not only aids in blood sugar control, but also positively impacts your lipid profile? These aren't merely suggestions. They are powerful, actionable tools within your grasp that can profoundly influence your internal lipid landscape. Beyond lifestyle, pharmacological interventions often become a cornerstone of your comprehensive lipid management plan. The most widely prescribed and remarkably effective class of medications for lowering LDL-C are statins. Do you understand how these remarkable drugs meticulously work within your body to provide such profound protection? Statins function by inhibiting an enzyme in your liver called HMG-CoA reductase, which is critical for the internal production of cholesterol. By precisely reducing your liver's internal cholesterol synthesis, your liver then increases the number of LDL receptors on its surface, effectively clearing more LDL cholesterol from the bloodstream. This doesn't just lower your numbers, it proactively stabilizes existing atherosclerotic plaques, making them less prone to rupture and reduces systemic inflammation, thereby fundamentally altering the trajectory of atherosclerosis. It's a sophisticated, multifaceted intervention. It is vital to remember that your specific treatment plan is not a one-size-fits-all approach. Your physician will meticulously consider your individual cardiovascular risk factors, your overall health profile, your tolerance to medications, to tailor the most appropriate strategy for you. This might involve different statin intensities or even combination therapies with agents like ezetimibe, which reduces cholesterol absorption in the intestine. For those with very high-risk profiles or statin intolerance, newer, highly potent therapies such as PCSK9 inhibitors might be considered, offering an even more profound reduction in LDL-C. These are not merely pills. They are precisely engineered tools designed to protect your most vital organs. The consistent adherence to these lipid-lowering strategies is not merely about achieving a desirable number on a laboratory report. It is fundamentally about protecting the very vessels that supply life to your heart and brain, dramatically reducing your personal risk of a future heart attack, stroke, or other major adverse cardiac event. It is about preserving your vitality, your independence, and your quality of life for many years to come. Do you see now how these targeted interventions are not just treatments, but rather profound investments in your enduring future and well-being? While optimizing your lipid profile is an absolutely cornerstone of cardiovascular protection, it is but one vital piece of a larger, interconnected puzzle. Another formidable challenge, particularly for individuals living with diabetes, is the silent yet pervasive threat of hypertension or high blood pressure. Have you ever considered the synergistic, amplified damage that uncontrolled blood pressure can inflict upon your cardiovascular system when combined with the chronic metabolic stress of diabetes? In our next segment, we will pivot to this equally critical area, exploring why effective blood pressure management is not just important, but absolutely essential for safeguarding your heart and blood vessels from further harm. While optimizing your lipid profile is an absolutely cornerstone of cardiovascular protection, it is but one vital piece of a larger, interconnected puzzle. Another formidable challenge, particularly for individuals living with diabetes, is the silent yet pervasive threat of hypertension or high blood pressure. Have you ever considered the synergistic, amplified damage that uncontrolled blood pressure can inflict upon your cardiovascular system when combined with the chronic metabolic stress of diabetes? In this segment, we will pivot to this equally critical area, exploring why effective blood pressure management is not just important, but absolutely essential for safeguarding your heart and blood vessels from further harm. You see, for individuals like yourselves, navigating life with diabetes, hypertension is not merely an additional risk factor. It is an accelerant, pouring fuel on the fire of cardiovascular disease. Think of your arteries, those vital conduits of life, as intricate plumbing. When blood pressure is consistently elevated, it's akin to a constant, high-pressure surge through those pipes. This relentless force causes microscopic damage to the delicate inner lining of your blood vessels, known as the endothelium. This endothelial dysfunction, already compromised by the chronic hyperglycemia of diabetes, becomes a fertile ground for the initiation and progression of atherosclerotic plaques. Do you fully comprehend the cumulative wear and tear this imposes on your most critical internal infrastructure, day in and day out? This dual assault, diabetes and hypertension, creates a particularly vicious cycle. Diabetes can stiffen your arteries, making them less elastic and more prone to damage from pressure fluctuations. Conversely, hypertension places an increased workload on your heart, forcing it to pump harder against resistance, which over time can lead to a thickening of the heart muscle, known as left ventricular hypertrophy. This isn't merely a structural change. It impairs your heart's efficiency and increases its susceptibility to failure. Furthermore, the combination significantly heightens your risk for microvascular complications, impacting the tiny blood vessels in your kidneys, leading to diabetic nephropathy, and in your eyes, contributing to retinopathy, conditions that can profoundly impact your quality of life. Have you ever considered the silent, insidious progression of these conditions, often without immediate symptoms, making regular monitoring and proactive management absolutely paramount? So, what are the precise blood pressure targets we advocate for you as individuals with diabetes in this age group? For many, the goal is often more stringent than for the general population, typically aiming for readings below 130/80 mmHg. In some cases, based on your individual risk profile and the presence of specific complications, your physician might even target slightly lower numbers. This aggressive management is not arbitrary. It's rooted in extensive research demonstrating that meticulous control significantly reduces your risk of heart attacks, strokes, kidney disease progression, and other major adverse cardiac events. Do you know your current blood pressure numbers? And have you discussed with your healthcare provider what your individualized target should be? Understanding these numbers is your initial, empowering step towards taking control. Achieving these vital targets, much like lipid management, begins with foundational lifestyle modifications. Are you consistently incorporating dietary approaches, such as the DASH, dietary approaches to stop hypertension, eating plan, which emphasizes fruits, vegetables, whole grains, and lean proteins while significantly limiting sodium, saturated fats, and added sugars? Are you actively engaging in regular, moderate-intensity aerobic exercise for at least 150 minutes per week, which not only lowers blood pressure, but also improves insulin sensitivity? Have you considered the profound impact of maintaining a healthy weight, managing stress through mindfulness or relaxation techniques, and, if applicable, moderating alcohol consumption? These are not mere suggestions. They are powerful, non-pharmacological interventions that could dramatically recalibrate your blood pressure and enhance your overall cardiovascular resilience. Beyond lifestyle, pharmacological interventions are frequently essential to achieve and maintain optimal blood pressure control, especially for individuals with diabetes. Your physician will meticulously select medications tailored to your specific needs, considering potential coexisting conditions and your overall health profile. Classes of drugs commonly employed include ACE inhibitors, angiotensin-converting enzyme inhibitors, or ARBs, angiotensin receptor blockers. Do you understand why these particular medications are often first-line choices for diabetics? They not only effectively lower blood pressure, but also offer significant renoprotective benefits, safeguarding your kidneys from diabetes-related damage. Other options may include thiazide diuretics, which help your body excrete excess sodium and water, or calcium channel blockers, which relax blood vessels. The selection of your specific regimen is a carefully considered decision, part of a sophisticated, individualized strategy to protect your heart and blood vessels. Crucially, consistent adherence to your prescribed medication regimen and regular monitoring of your blood pressure are non-negotiable. Self-monitoring your blood pressure at home, as advised by your healthcare provider, empowers you with real-time data, allowing you and your physician to make informed adjustments to your treatment plan. This vigilance is not just about compliance. It's about actively participating in the meticulous management of your long-term health, ensuring that your cardiovascular system remains as protected as possible. Do you recognize the profound impact of this consistent, proactive engagement in safeguarding your vitality and preventing future complications? By diligently managing your blood pressure, you're actively mitigating one of the most significant accelerators of cardiovascular disease in the context of diabetes. You are protecting your heart from undue strain, preserving the integrity of your blood vessels, and dramatically reducing your personal risk of heart attacks, strokes, and kidney failure. This is not merely about managing a number. It is about investing in a future of sustained health, independence, and an enhanced quality of life. While optimizing your lipid profile and meticulously controlling your blood pressure are foundational pillars, there remains a third, equally critical component in our comprehensive strategy to protect your cardiovascular health: the judicious application of antiplatelet therapies. Have you ever considered how subtle changes in your blood clotting mechanisms, particularly with diabetes, can significantly increase your risk of dangerous blockages? In our final segment, we will delve into the nuanced world of antiplatelet medications, exploring their role in preventing the very formation of the clots that can lead to devastating cardiovascular events. Indeed, the intricate dance of your blood's clotting mechanisms takes on a heightened significance when you are navigating life with diabetes. You see, your body's natural response to injury involves platelets, tiny, disc-shaped cells in your blood that rush to the site of damage, clumping together to form a plug and stop bleeding. It's an essential process for survival. However, in the context of diabetes, this finely tuned system can become overactive, almost hyper-responsive. Have you ever considered that the very elements designed to protect you from bleeding can, under certain conditions, become a threat within your own vessels? Chronic hyperglycemia, insulin resistance, and systemic inflammation, all hallmarks of diabetes, create an environment where your platelets are more prone to activation and aggregation. Imagine these platelets as becoming stickier, more easily triggered to clump together, even when there isn't a significant injury. This predisposition dramatically increases your risk of forming clots within your blood vessels, particularly in areas already narrowed by atherosclerotic plaques. These clots, when they occur in your coronary arteries, can block blood flow to your heart, causing a heart attack. If they form in the arteries leading to your brain, they can lead to a stroke. Do you realize how this subtle yet profound alteration in your blood's internal environment places you at an elevated risk, even when your other numbers seem well managed? This is precisely where antiplatelet therapies enter your comprehensive care plan. The most commonly prescribed antiplatelet agent for individuals like yourselves, particularly those with diabetes, is low-dose aspirin. Do you understand its remarkable mechanism of action? How it quietly yet profoundly safeguards your cardiovascular system? Aspirin works by inhibiting an enzyme called cyclooxygenase 1, or COX-1, which is crucial for the production of thromboxane A2, a powerful substance that promotes platelet aggregation. By blocking this pathway, aspirin effectively reduces the stickiness of your platelets, making them less likely to clump together and form dangerous clots. It's a subtle yet incredibly powerful intervention that helps maintain the smooth, unimpeded flow of blood through your arteries. The decision to initiate antiplatelet therapy, particularly with low-dose aspirin, is a nuanced one, meticulously weighed by your physician. For individuals like you, aged 45 to 54, with diabetes and at least one additional cardiovascular risk factor, such as hypertension, dyslipidemia, smoking, or a family history of premature cardiovascular disease, aspirin therapy is often recommended for primary prevention, meaning to prevent a first cardiovascular event. This proactive step can significantly reduce the likelihood of that initial, life-altering cardiac incident. If, however, you have already experienced a heart attack, stroke, or have established peripheral artery disease, aspirin, or sometimes even more potent antiplatelet agents, becomes a cornerstone of your secondary prevention strategy, aimed at preventing recurrent events and ensuring your future resilience. Have you had this critical conversation with your healthcare provider about whether antiplatelet therapy is appropriate for your unique risk profile, considering both your diabetes and any other coexisting factors? While the benefits of antiplatelet therapy in reducing major adverse cardiac events are substantial for individuals with diabetes, it is crucial to acknowledge the potential risks, primarily an increased risk of bleeding. This could range from minor bruising or nosebleeds to, in rare cases, more serious gastrointestinal bleeding or hemorrhagic stroke. Your physician will carefully assess your individual bleeding risk against your cardiovascular benefit to determine the most appropriate course of action. This is why self-medication is never advisable. It is a personalized medical decision that must be made in consultation with your healthcare team, where your unique circumstances are thoroughly considered. Do you understand the importance of openly discussing any concerns or side effects you might experience with your doctor, ensuring your safety and the efficacy of your treatment? Consistent adherence to your prescribed antiplatelet regimen, just like with your lipid-lowering medications and blood pressure treatments, is paramount. These therapies are most effective when taken regularly, as directed, becoming a consistent, protective presence in your daily routine. Do you recognize that each of these pillars, meticulous lipid management, rigorous hypertension control, and judicious antiplatelet therapy are not isolated treatments, but rather interconnected strands of a robust, comprehensive tapestry of cardiovascular protection. They work synergistically, each reinforcing the other, to create a formidable defense against the accelerated cardiovascular disease risk that diabetes presents to your body. By embracing this holistic, proactive approach, you are not merely managing a condition. You are actively shaping your future. You are empowering yourself with the knowledge and the sophisticated tools to mitigate the silent threats, preserve the vitality of your heart and blood vessels, and significantly reduce your personal risk of life-altering cardiovascular events. This isn't just about prolonging lives. It's about enriching it, ensuring that you can continue to enjoy your independence, your passions, and your cherished moments with loved ones for many vibrant years to come. Do you feel empowered now, armed with this comprehensive understanding, to engage more deeply and confidently in your cardiovascular health journey? Remember, your health is your most profound investment, and your proactive engagement, guided by expert care, is its most powerful safeguard. We hope this journey has illuminated the path to a healthier, more resilient you. Thank you for joining us.